Hello and welcome to Boundless Dentistry. Here we'll talk about medical emergencies. Now, medical emergencies which can occur in dental practice, they can be life-threatening for the patient if they are not timely and properly managed. So, in this video, we'll talk about the most common medical emergencies that can occur in a dental practice. So, let's get started. Now, to begin with, medical emergencies, they are serious conditions and they are unexpected conditions which can occur at any point and happen at the start of the treatment, at the middle of the treatment, or towards the end of the treatment. So they are serious and unexpected in nature. Now, when these medical emergencies occur, the patient has to be treated immediately. There is supposed to be no delay because if there is some delay or no action is being performed, it can be life-threatening for the patient as well. Now, these conditions vary from can be, for example, not that life-threatening up to a condition which can be life-threatening and some help has to be called for in order to save the life of the patient. There are different types of medical emergencies which can occur in a dental practice. For example, syncope, myocardial infarction, angina pectoris, airway obstruction, asthma, hypertension, hypoglycemia, and seizure, and some drug related and allergic related emergencies as well. Now, most of the medical emergencies, as you can say, 99% of medical emergencies revolves around asthma, hypotension, hypoglycemia, seizures, and all of these. 99% of the medical emergencies will be in one of these categories. So we'll talk about all of these medical emergencies now in detail. Now let's just start with syncope now. What is syncope? Syncope is basically a feeling where there is loss of consciousness. There is loss of muscle strength as experienced by the patient. It occurs suddenly, like there is no aura that the patient experiences like now that the syncope is about to occur. It occurs very suddenly and it is of short duration, and most of the patient they recover spontaneously. Now, what are the causes which can be associated for a patient to suffer from syncope on the dental chair? Now, if we talk about central nervous system related causes, patient might have hypoxia or hypoglycemia. Patient can suffer or has a history of suffering from epilepsy. Some anxiety, as some patients they're very fearful of getting dental treatment done. So anxiety is also one of the reasons. And lastly, and a bit rare, is the disorders of brain stem. On the other hand, if we talk about cardiovascular diseases, patients which are susceptible towards heart attack, embolism, aortic stenosis, arrhythmias, and tachycardia. These are the cardiovascular causes which are associated, which can lead to patient experiencing syncope. Other causes include vasovagal syncope. Some patients have, although these are rare situations, but they can be present. For example, patient has sensitive carotid sinus and some ENT related causes as well. So syncope is one of the most common medical emergencies which a dentist can experience seeing a patient at the dental chair. We talk about symptoms which a patient experiences while having syncope is patient will experience irregular breathing, dilated pupils, convulsive movements as jerky movements, bradycardia as the heartbeat slows down, weak thready pulse, loss of consciousness, and airway obstruction. Patient can experience these symptoms. Now, once we have recognized that the patient is actually suffering from syncope, how we can manage that patient in our dental practice? Firstly, regarding position, we place the patient in a supine position with legs slightly raised above so that there will be increased blood supply towards the brain, which will help the patient to regain their consciousness as soon as possible. Also, we go for A, B, C, D, E, which is the protocol that we follow so that we can provide the patient with treatment as soon as possible. Now, after we have performed the emergency management, we go for definitive treatment. For example, we measure the signs, vital signs of the patient, for example, heartbeat, temperature, oxygen saturation, and blood pressure. Also, sometimes we can provide the patient with aromatic ammonia, which also helps the patient to regain their consciousness. And last option that we have is atropine. Now, this is how we manage a patient who is suffering from syncope, because syncope is one of the most common medical emergencies that we can find in our dental practice. Now let's talk about seizures now. Seizures are basically a condition and it is life-threatening if the patient is not treated as soon as possible. Patient experiences jerky movements, there is loss of consciousness, and normally it occurs for a brief duration, but it can be prolonged, and that prolonged version of seizure is very serious for the patient. Regarding the symptoms, patient has experiences blank staring at something without blinking their eye. They are just staring at the, for example, a wall. There can be some chewing, fumbling, shaking, and the patient experiences altered speech. Now, how we can prevent from such seizures occurring in our dental practice, specifically our dental chair? We have to take a proper history of the patient. For example, if the patient has a history of epilepsy, we have to make sure that the patient is on their medication. They're taking their anti-epileptic drug regularly. And just in case that the patient might suffer from epilepsy, we have to make sure that we have life support medications already available with us at our dental practice, so that we can prevent from such condition from occurring. As you can see in this picture as well, when the patient actually suffer from seizures, they have jerky movements, they have lost their consciousness, and we have to make sure to treat the patient as soon as possible. Regarding management of the patient that now we've identified to suffer from seizure, there are two main things that we have to do. Firstly, there is initial treatment and then there is definitive treatment. Initial treatment involves the procedure, for example, that is being carried out on the patient. It can be root canal treatment, it can be dental extraction, fillings, any treatment that is the patient is undergoing right there and then, and the patient at that time experiences seizures, we have to stop all treatment. Any equipment that is present at the immediate periphery around the patient, that has to be removed, because as the patient is experiencing seizures, because of the jerky movements, it can harm the patient as well, along with the doctor and the staff around. Secondly, no instrument or anything has to be placed in the patient's mouth, because that can lead to airway obstruction, and there is no straining towards the patient. The patient has to be allowed to move a bit. We don't have to hold the patient, because the seizure occurs for a brief period of time and it will eventually be better. Now, if we talk about definitive treatment, we have a drug which is called as diazepam. We can give 10 mg IV every 10 minutes so that patient gets better. Phenobarbital is also an option which can be given IV 100 to 200 mg. Other than that, we have carbamazepine and phenytoin as well. So these are the different treatment options that we can offer to the patient who are suffering from seizure, because if the patient is not treated at time and duration is more than 30 minutes, it can lead to status epilepticus, which is a serious medical emergency, and the patient now has to be admitted to the hospital and carried by an ambulance. So this is how we measure this is how we treat a patient and manage a patient who is suffering from seizure as our dental practice. Now moving on towards another medical emergency, which is a very common medical emergency, is called as hypoglycemia. Hypoglycemia simply means that there is low glucose serum levels, which is around less than 10 mg per 100 ml. So this is hypoglycemia. A very common medical emergency that we experience in our dental practice. Now, what are the different causes which can lead towards hypoglycemia? There are two main causes. Either the patient is to undergo extensive dental procedure and they have not had, for example, in the morning, they did not have any breakfast, or for example, in the night or in the evening, they do not have any dinner or lunch. So that is one reason, empty stomach, which can lead to hypoglycemia. And secondly, diabetic patients, if they have taken their morning insulin, so that will decrease their glucose level. So initially it starts as anxiety. Patient starts to feel anxiety because one of the symptoms of hypoglycemia is anxiety. Next, the patient starts to experience some weaknesses. Then there will be dizziness as the glucose level of the serum is going down. Other than that, patient will now, we will, as a dentist, we will observe that the patient has now pale skin, and then finally and eventually the patient will start experiencing syncope or loss of consciousness. Now, what are the symptoms that the patient will give to us as the patient is suspecting that their glucose level is going down or they are not feeling well? They will experience unconsciousness. It will be very sudden in onset, trembling, pale color. Patient will experience increased sweating, sudden hunger because their glucose level is going down, so they will experience that they need something to eat as soon as possible. They will be confused and disoriented, and they will experience anger. So these are the symptoms that patient will report to us, and we will have an idea that whether the patient is suffering from medical emergency. If yes, the patient might be suffering from hypoglycemia. Now, after we have reached the initial diagnosis that the patient might be suffering from hypoglycemia, how will we manage such condition? We can give oral sweet drink that the patient can drink via their mouth, and that will help most of the patient. In almost all of the cases, patient will experience better. Other than that, we can also give patient candy bars. In some severe cases where even oral sweet drink and candy bars are not effective, we can go for IV dextrose, which is used in severe cases if the patient is initially not responding to any of the above mentioned treatment plans. Also, we can go for glucagon, which can be given as intramuscular injection 1 mg. And other than that, we have metformin, sulfonylureas as well. These are the medications which can be given to the patient, and these medications have to be available at the dental practice with the dentist, so that if the patient suffers from such medical emergencies, they can be immediately provided with such management options. Now moving on towards airway obstruction. Airway obstruction is also a common medical emergency which can occur. For example, patient has inhaled a denture, any dental prosthesis patient can inhale. In terms of patient losing their consciousness or other condition, for example, patient has epilepsy, so they can inhale such dental prosthesis, and which can lead to airway obstruction. In other than that, patient can have some airway pathology associated, for example, periorubin sequence. Sometimes tongue can fall backwards in patients who have lost their consciousness, and then that can also obstruct their airway. And as I've already talked, dentures as well. So these are, and dental instruments as well. So these are two dental related issues that can lead to airway obstruction. Now, how we can prevent such obstruction from occurring? For example, if you're using endodontic files, so it is very important to use rubber dam. It will help prevent airway obstruction. Also, in some extensive procedure, for example, multiple extractions, so oral packing is important so that there is no anything falling back down the throat of the patient. Chair positioning also very important, because if the patient is very reclined, so that increases the chances of airway obstruction. And the dental assistant should also be vigilant, so that they are looking that whether something can go down the throat of the patient or not. As you can see in this x-ray as well, this is a dental prosthesis which has been blocked in the trachea of the patient, and then patient experience airway obstruction. Now, talking about the different management options that we have for patients who are suffering from airway obstruction, we can ask the patient for forceful coughing. This, in most cases, it can be helpful, as forceful coughing pushes the instrument or anything that is just initially at the top position of the trachea, it can be expelled out. Other than that, we can also go from back blows, and it can also be beneficial for the patient. It can help, for example, a denture to come out. Heimlich maneuver is one of the most commonly performed procedures, which helps in most of the cases for patients who have some airway obstruction. We can also go for chest thrust as well, and finger sweep as well. As you can see, two fingers are pushed down the throat and then they are swept upwards, which can help and remove any airway obstruction which is present, and which definitely helps patient a lot. So this is how we will manage a patient who is suffering from airway obstruction, and we have to make sure that we prevent from such medical emergencies to occur, as it is life threatening for the patient. Moving on towards hyperventilation. Now, what do we mean by hyperventilation? Hyperventilation simply means that there is increased rate and depth of breathing. Now, two reasons are associated with hyperventilation. Firstly, stress and anxiety, and these are some fearful symptoms that the patient has when they're visiting, most commonly for the first time ever, to a dentist. So they have many fears associated with the dental treatment, and that stress and anxiety leads to hyperventilation. Now, what are the signs and symptoms that the patient experiences or presents to us? Rapid short breaths, cold sweats, palpitations, increased heart rate, and dizziness. Now, how we can prevent from such hyperventilation scenarios to occur? We can reduce the stress and anxiety of the patient by properly counseling them and explaining them and going step by step in order to achieve the treatment plan. Also, sometimes we can give a patient a paper bag. Now, what does this paper bag do? Basically, CO2 is released back into the body, which helps to normalize the breathing. And another important thing which is commonly not focused upon much is the operator to be calm as well, because if the dentist is not calm, him or herself, which can lead to increased anxiety in the already anxious patient. Now, how will we manage a patient who is suffering from hyperventilation? As you can see in this picture, the patient has been provided with a paper bag, and that CO2 which is released inside the body again helps to normalize in breathing. Other than that, the most common medications which are used to treat or to handle the patient who is suffering from hyperventilation is benzodiazepine, because these benzodiazepines basically help to reduce the stress and anxiety of the patient. We can go for diazepam IV, lorazepam orally, Trizolam IV, alprazolam oral. So these are the medication which can be given to the patient. These medication have a single target, that is to reduce the anxiety and stress of the patient. And when these two triggers have been handled, patient eventually gets better and hyperventilation is gone. So this is how we'll treat a patient who is suffering from hyperventilation. A common airway problem or medical emergency which occurs is called asthma. Now, asthma is one of the most common chest or lungs pathology that the patient suffer from, and we have to make sure that we take a proper history of the patient so that we can avoid situations where this asthma is triggered, because dental treatments, they are stressful situations, so this can trigger asthma. So while the patient is on the dental chair, we have to make sure that we recognize the symptoms that the patient is actually suffering from an asthma attack. As soon as patient suffers from asthma attack, we have to stop all dental treatments. Then we have to make sure the patient is in upright or bending position forward, because that helps the patient to breathe properly in a more effective manner. Also, other than that, if the patient do not have bronchodilators with them, we need to keep bronchodilators in our emergency kit, so that if the patient is suffering, we can offer that patient bronchodilators, and that will in most cases help the patient and reduce the symptom of asthma and return the patient towards normality. If still the asthma does not terminate, it can lead to status asthmaticus, and this is a serious medical condition, and that the patient has to be admitted to a hospital. Another very serious medical condition or medical emergency which can occur in a dental practice is called as myocardial infarction, or simply heart attack. Because some patients are very fearful and stressful, and they already have some myocardial pathologies, or you can say atherosclerosis associated with the heart, that can trigger an episode of myocardial infarction, because patient does have some underlying heart disease as well, and these underlying heart disease is exacerbated in the presence of stress. How we can prevent a myocardial infarction from occurring? We can reduce the stress and anxiety of the patient. We have many methods, behavior methods, pharmacological methods. We have to make sure to use those methods. We can also provide patient with supplementation of oxygen, pain control, because excessive pain leads to increased stress, and that stress can trigger an episode of myocardial infarction. Other than that, intra-alveolar and posterior superior alveolar block is to be avoided, because epinephrine which is present in the local anesthetic, the anesthesia can be released in the arteries, and those epinephrine in the arteries then can lead to an heart attack. So we have to avoid inferior alveolar and posterior superior alveolar block. We have to avoid that. Now, if we recognize that the patient is actually suffering from myocardial infarction, the most important thing to keep in mind is that we have to make sure that the patient reaches the hospital as soon as possible. But whilst, for example, there is an attendant of the patient who is waiting for an ambulance or someone to take that patient to the hospital, we have some treatment option that we can give the patient at that very moment, which can be life-saving for the patient. We can give antiplatelet drug, for example, aspirin, clopidogrel, and dipyridamole. Now, these are the drugs which can be given to the patient, which can help to dissolve the clot which is already present in the patient heart, which has caused heart attack. So these drugs can be life-saving for the patient. Other than that, we can go for propranolol, metoprolol, and atenolol. These categories of drug, they basically are life-saving for the patient while the patient is being transported to the hospital. So this is how we'll manage a patient who is suffering from myocardial infarction. Now, lastly, talking about another very common medical emergency which does occur in the dental practice is called as angina pectoris. Now, we have three variants of angina pectoris, and when the patient suffers from angina pectoris, they basically feel a very heavy and painful feeling in their heart, and that radiates to their sometimes their jaw and arm as well. And within 30 minutes, basically it resolves. And if it's more than 30 minutes, we can suspect that the patient is suffering from myocardial infarction. So, angina pectoris is of three types. We have stable, variant, and unstable. Out of these three, unstable angina is the most dangerous angina because it basically leads eventually towards myocardial infarction, and it is difficult to manage in a dental practice. Now, how we can prevent angina pectoris from occurring? Now, angina basically occurs when there is increased stress and anxiety of the patient, and the patient already has some underlying heart disease. So, we have to make sure to decrease the stress and anxiety of the patient. We can use different pharmacological methods, for example, giving benzodiazepine, sometimes even nitric oxide inhalational form we can give to the patient. It definitely helps patient a lot. Other than that, we have to give patient reassurance. For example, they are scared of the dental treatment as to they can feel some pain or anxiety during or before the treatment. So we have to make sure that the patient understands the treatment procedure, and we have the confidence of the patient that the patient trusts their dentist, and that will help reduce the stress and anxiety of the patient. Psychosedation is also one of the methods which can decrease stress and anxiety of the patient. Now, if for example the patient has eventually suffered from angina pectoris, how we can manage it? Firstly, we have to recognize it. The symptoms that the patient is reporting to us, we have to make sure that we have enough knowledgeable that we do know that the patient is actually suffering from angina pectoris. Next, we have to stop all dental procedures, and then we have to make sure that the patient is now in upright position. We have to perform basic life support, and then immediately we have to go for sublingual nitroglycerin every 5 minutes. That will basically help improve the blood flow towards the heart and can be life saving for the patient. And then later on we can give beta blockers to the patient, so this will help the patient to recover from an episode of angina pectoris. But if the patient has suffered from the episode, we have to refer them to their physician, and if in case of unstable angina, we have to immediately make sure that the patient reaches the hospital and they are provided with their proper care. So in this video, we talked about the most common medical emergencies that we experience in our dental practice, starting off from with syncope, then we talked about airway obstruction, then we talked about asthma, then we talked about myocardial infarction and angina pectoris. So I hope this video was useful for you, and if you like this video, please like, share, subscribe and press the bell icon. Thank you for watching this video. See you next time.